My name is Corey Lehreman. At time of recording, it's Sunday, August 9, 2020. It's been about 5 months since coronavirus, COVID-19, started to sweep our nation from shore to shore. The world awaits a vaccine, but one has not come yet. Experts say it could be years before a vaccine is widely available to the public, but I believe that the United States does have the ability to keep it at bay until then. Success starts in your local region, though, and it requires awareness and insight beyond what they show in the national news. As part of my graduate coursework, I've spent over 100 hours developing a tool to help you with your awareness and insight. It's called COVID-19-Watch, and I'm about to show you how it works so that you can see COVID-19 in your local area and see how your community fits into the bigger picture. So let me open up my web browser. The URL is www.covid-19-watch.com. Once the app loads up, you'll start on a map of weekly new cases. But the first thing you'll want to do is actually find your local status report. I live in Fairfax County, Virginia, so I'll type that into the search bar. If you don't know your county name, you can always just type your town or local area as well. So you see that my county's been highlighted in the map, and that a status report has shown up here on the left-hand side. So let's walk through the status report together, and I'll zoom in a little bit to make it a little easier to see. So the status report's for Fairfax County, and it's using data as of August 8. The latest data will always be the day before, since that's the most recent complete daily count. My county is reporting 613 new cases of COVID-19 over the past 7 days, and the rate of new cases is accelerating compared to 2 weeks ago. You can see that clearly in the chart of weekly new cases. We've had more new cases this past week than in any week in the past month. More concerning is that we've had 7 deaths in just the past week. That's like one every single day in just my county. And here's the useful part. I think we can agree that we don't like the metrics we're seeing on this report. 1 death is too many, let alone 1 per day. You can copy the direct URL to this status report and send it to your friends, family, even coworkers. Remind them to wear a mask. Remind them to be careful and take it seriously. And with these status reports, you can connect them with numbers that are easy to understand. So let me open that link in a new tab here just so you can see. You'll see that it will automatically open to the same status report that you were just looking at. And it is even mobile friendly, so you don't have to worry about their access. I recommend bookmarking your local status report as well. The status report URL will always show you the latest available data. My web robot, Diego, automatically harvests and aggregates all this information daily from Johns Hopkins for you. There are status reports for every single county, city, or state in the U.S. In fact, this app is currently capable of producing over 80,000 unique status reports, depending on the jurisdiction and time stop that you select. So, what if we want to compare ourselves to our surroundings? Pay particular attention to the population normalized value. That's the per 100,000, right? That's the per capita, essentially, per 100,000 though. So Fairfax County is getting 54 per 100,000 new cases per week. So if we click over here to the west, let's see how our neighbor Loudoun's doing. Just click local, and they're doing 61 per 100,000. So similar, they're pretty similar, a little bit higher, but same ballpark. If we go south to Prince William, they're a little darker on the map, so we can expect a little bit higher per 100,000 rate here, and it's 119. It's over, over double what our per 100,000 rate is in Fairfax County, unfortunately. Now, what if we wanted to compare Fairfax County to Virginia, to the whole state? So you can hit local or you can hit state and see the status report for the entirety of Virginia. We can see that Virginia as a whole has reported over 8,000 new cases, in the past week. But if we look down here at their new cases per week, per 100,000, again, there's the number we can compare. So 98 per 100,000 compared to our local 54. So it looks like our county, Fairfax County is doing better on average, compared to the whole state, unfortunately. And if we want to compare state to state, you can do that too. West Virginia, 43 per 100,000. Virginia, of course, we just saw 98 per 100,000, so West Virginia is doing a little bit better right now. Of course, if we start looking south, we know that the South is unfortunately having a lot of trouble with COVID-19 right now. So we're looking at Florida, 225 per 100,000. That's over double the per 100,000 rate of Virginia, and over 4 times the per 100,000 rate for Fairfax County. So another way to understand where we are now is to figure out where we've been. So let's take a closer look at the map itself. I'm going to move some of the things out of the way here. So I'm going to step back in time and play every week since mid-February. And I'll let it run through once, and then we'll take a closer look together. This is February, March, April, May, June, July, and August. And now we're back to our latest data. So let me scrub back and we can take a closer look together. As we advance through time, you can see the spread happening, and I'll stop right about here. We can clearly see several early outbreaks, right? Obviously, the New York City area was one. They were hit hard really early on. New Orleans, Louisiana, and then this sort of surrounding Albany, Georgia was another early spike, and a little bit of the beginning of an outbreak over here in the Navajo Nation. So let's keep going forward. And I'll stop here. This is 2 weeks before the current data. And this did appear to be the sort of highest spike of this most recent summer Florida outbreak. If we step forward back to current couple weeks, and if I just kind of go back and forth, you can kind of notice, if you pay attention to the colors in the south, that the rates are getting a little bit lower, ever so slightly. So now I'm going to show you something that's another powerful tool to see change, and that's acceleration. It's like turning on X-ray vision. So I'm going to toggle the legend back to acceleration here. Well, not back to, but so I'm at the latest time stop now, and you see a lot of orange and a lot of blue on the map. So orange is for acceleration, right? And then blue is for negative acceleration or deceleration. So the map shows the difference in new cases compared to 2 weeks prior. So you might be seeing this and you might be thinking, well, the South is mostly blue, but the rate map looked pretty bad, right? If I go back to the rate map, it's still high rates. Well, that's because you're looking at the change in rate. So what that really means is if you're scrubbing through and you see orange change to blue, what that indicates is that they're just starting to get over the hump. It is a positive thing, but it doesn't mean that the region is all good. But it might mean that the measures and policies that they're enacting may be slowly starting to work. So if you see blue, keep playing it safe. If you see orange, you might be in the thick of it, or it might get worse before it gets better. So let's show another thing here. I'm going to adjust the map a little bit. So if you'd like to visualize those sort of nationwide spikes we were talking about earlier, you can actually just type USA to get the national status report. So what I'd like to show you, if you watch the red new cases line chart on the left, you'll actually be able to see those spikes visualized before us. And I'll start at the beginning so you can see them, and I'll scrub through. So we're going forward. There was our first kind of initial spike, and then we leveled out for a while as a nation, and now we've hit this large second spike, and you can see the chart moving in tandem with the map here. Now I've just one last thing to show you, and it is the recovery map. Now what this map shows is it gets increasingly more green the more weeks, the more counties go without reporting a new COVID-19 case. So let me play it from the beginning. So in the very beginning, you see lots of gray. That means that there have not been any cases reported yet. White means that there are new cases, and that county hasn't gotten to the point where there aren't any more new cases. And as we scrub through, you start to see a lot of green here, but the green starts dropping off relatively quickly as we hit our sort of second nationwide spike. Now, this map isn't extremely useful right now, but it was important to me that I added it because, I look forward to the day where it does fill up with green. And I think that with better dedication and communication, I hope that day will come sooner rather than later. I think everyone can help, right? Share information from this app to inform others around you, wear a mask, stay engaged, and follow advice from the CDC and local health officials. And most importantly, encourage others to do the same. If you'd like to visit this app yourself, like I said, just go to www.covid-19-watch.com. I want to give a special thanks to Johns Hopkins CSSE for continuously collecting and publicly releasing the raw COVID-19 data necessary to create a tool like this. I'd also like to shout out to the University of Wisconsin-Madison, where I'm currently earning my master's in GIS and web map programming. Thanks for watching.